Hello, everyone, and welcome back to the Non-Traditional Nurse Podcast. Today, at the request of our listeners, we're going to shine a spotlight on nursing informatics, and I'm so excited to have Wendy here with us today. Thanks for joining us, Wendy.
Absolutely. Thank you for the invitation.
And Wendy is a nationally recognized nurse leader and informaticist. She has over 2 decades of experience across health systems, startups, and major informatics organizations. She has been at the forefront of digital transformation in nursing, and she is just bringing a wealth of insight into how nurses can lead in health technology and kind of shape the future of the profession, really. So thanks again for coming.
Absolutely. Thank you, Ellie.
And so, can you just start by telling us about your specific nursing journey and how you became involved in informatics?
When I was going into school, going into college, I was really interested in technology and I was really interested in nursing. And I didn't know which path I was going to take. And I took the nursing path, but still was completely interested in technology. So when I started in a cardiac step down unit and practicing where I was for about 4 years, I just saw that there were a lot of inefficiencies in what we were doing that were affecting productivity, for one, but also patient safety and patient care. And then I found out about the specialty of nursing informatics and that I could actually do both nursing and technology. And it was a time where we were starting to move our documentation and physician orders from paper to a digital tool, such as the EHR and others. And I was really excited. So I found out what it was, or I heard it, and I said, "I'm doing that," without even knowing actually completely what was involved. But I did everything I needed to do. First off, to get my certification from the ANCC. And had to take the prerequisites and make sure I had enough practice and do some continuing education. But I got certified, and then a couple years later went back and got my master's in nursing in nursing informatics. So I took the more formal education and certification route, but there are different routes to take.
Sure. And I love that you were able to circle back and use some of your other skills. I think that's what I love most about like non-traditional nursing roles is, I was looking at a bunch of different colleges, a bunch of different degrees, and I had the same thing. I wasn't sure and I loved so many different areas. And now I'm able to kind of use those different outlets in some of my work. So what a great story. And I know nursing informatics is kind of a big umbrella and it can include a lot of things. So, can you explain your definition of what nursing informatics might include?
The definition formally of informatics is nursing science, informational science, and information and technical sciences, all melded in one, which is kind of a very broad, vague definition of what nursing informatics is. But as a practicing informaticist, and what I did and where I started was really being that liaison role between technical teams and clinical teams. And I think that's the best description of what informaticists do. I think we'll get in more into where nursing informaticists can make an impact, but it's that human interface between the technology and between the clinicians that we work with and being able to serve them to broadly take care of patients. If we leave the bedside completely to go into nursing informatics, you're still making uh, so much of a contribution to patient safety and quality in the practice that others are doing.
Yeah, you really are. And like, who better to do it than having the people that worked on the front lines also bridge that gap because there's great engineers and IT people, but we really need to have that clinical insight as well. So I just love this profession.
Great.
So you published a book last year, so congrats on that.
Thanks.
And so, your book, Nursing Informatics Truths, Talents, and Transforming the Future, what is one truth about nursing informaticists that tends to surprise readers the most?
Well, in the realm of technology and nurses, I think one of the most stark uh, kind of myths that we have is that nurses shouldn't have a voice. We lack visibility in what it is that we really do every day. And one of the truths is that we tend to not really have that voice or visibility and give that contribution when we're in the full life cycle design and development phase of solutions. That could be in companies, there could be initiatives in health systems, and then certainly just your implementations of like the EHR in hospital settings. And sometimes those technologies just kind of fall into our laps and we weren't part of that life cycle of the design and testing, and can find out at the time of training that there's something new that you're going to do, but
Yes.
we weren't include a lot of times we're not included from the beginning where we need to be, because we need to be the ones who are telling the developers, is this going to be used and as intended, and is it going to be helpful and beneficial? And without the nursing voice, you just don't know that.
Yeah, that is a tale as old as time of us getting something delivered to us and just frustration after frustration. And to even think like how anyone would come up with something without a nurse at the table talking about who's going to be using that. So I think that's such a big point.
Yeah.
Now, Wendy, you have worked across many sectors, health system startups, nonprofits. What skills from your bedside days have translated really well or served you the most in your non clinical informatics work?
I'd say the nursing frameworks that we use in our care settings, such as, and that we learn, such as the nursing process, certainly, our critical thinking. And then also, I'm a big fan of the S bar in communication. And I've found that that works really well for technology teams when you're trying to be able to tell them, here is our problem, the situation, here's the background of why it's happening, here's my personal expert assessment, and then here's my recommendations. I think critical thinking is always important, and then also, one more thing to add, as nurses, we are very, very creative, um, practicing in everything we do because we have to be. We want to save time, we want to be efficient, and we want to save patients. So we know that we have a lot of workarounds because we have to, and we do whatever it takes. And that
Yeah.
translates very well to like ambiguity and uh, the iteration and prototyping that you need to do using things like design thinking without even realizing it, but being able to go into those settings and those environments and use all that we took from our clinical practice. I've found that's very successful.
Yeah. And creating actual solutions to the workarounds so we don't need to have workarounds.
Yeah, yeah, we're
Yes.
very innovative. Very
Yes, we
innovative.
sure are. All right. And a hot topic these days, obviously, is artificial intelligence. So, from your perspective, how has AI already impacted the field of nursing informatics, and where do you see the biggest opportunities or concerns for nurses moving forward with that?
AI in nursing, I think we're at a real big interest point. There's a lot, as you said, Ellie. There's a lot of uh, let's write about it, let's talk about it, let's do thought leadership, let's do research, and we're not at the point yet where we're really utilizing the technology because we're still in that slow development pace. There's not been a lot of nurse led, nurse developed, nurse centric and targeted technologies for AI, but that's starting to change. So I think that's where we are. And if I had any concerns, I would say that we still are lacking, despite all the thought leadership that's out there, we're still lacking in that real tactical literacy that we need for AI and what that is going to mean in utilization, in settings and at the bedside. We just don't have that yet. So that's my concern. I think we need to bridge that gap. And
Yeah.
then also, I think the opportunity will be for just transformed roles related to AI. There's so much that happens before a deployment of AI and after it is, put into place and falls in our laps and we're using it. And that needs the nursing voice. And we're going to have to practice in different ways. It's going to create more roles than less roles. If the nursing, workforce is reduced because of AI in some sector or some organization, I just really like to say that we need to reskill, reallocate, and retain our resources. I could keep you on and tell you about the 15 roles I think would be perfect for nurses to do, related to AI, even if they're not, if the workforce isn't reduced. Just what's going to come to us, what
Sure.
developers and designers are going to realize, and what organizational leaders are going to realize. Oh, we need this role or we need that role to support it. So I think that's where we're going. I really send the message to a lot of people, don't worry. This is just, we're not quite ready. We don't totally know what our transformed and new roles are going to be because of AI.
Yeah. And we might have to circle back on that list of 15 jobs in the future.
Cool.
But yeah, it goes back to what we talked about a little bit ago is like, I love to hear and meet. I'm meeting some nurses that are working and, building out this AI and different things. And that needs to happen, or we go back to just these frustrations if things get rolled out without our voice. So that is just so
Mm.
important. So, if we're talking to a bedside nurse who is really interested in building a future in informatics, but doesn't feel like they're quite ready to make that leap today, what might your recommendations be to, gain relevant experience or kind of open doors for new opportunities?
I think to find, some opportunities to be able to get in, it's really important two ways to do that. The first is to, if you're interested in technology and there are technology projects or initiatives or you see things coming down the pike, raise your hand to be involved. Because while we omit the nurse voice a lot of times, when you raise your hand and you just want to get involved and volunteer, you know, people realize, and that door does open for, oh yeah, we need the clinical experience and voice and talk about really what's happening with all of our workflows and what it's like to work with patients and how this is going to impact them. So I would say that's the first way to get in the door. I would say another one is to learn as much as you can and get involved in different organizations that are going to teach more about informatics. There's a lot to read. There are a lot of, like I said, associations and organizations that can really help with that. Not all nurses are able to go to conferences all the time. Take that opportunity if you have it, or go to those organizations and do their webinars and read their papers and all the resources that they create. That was something that I did to gain a lot of knowledge. It's really out there. From these nursing and non-nursing institutions that can provide that information. And I always say getting involved at, the local or national level with those types of organizations is so very, very important. And then the last thing I'll say is find someone who's an informaticist. Find someone who's willing to coach you, whether it's in your organization or outside of your organization. There are opportunities, or mentor who can provide opportunities and some
Yeah.
wisdom and tell nurses what direction to go into, give that detailed information, tell their stories, and give them that security and information and comfort that they need to think, yeah, I can do this too.
Yeah, that is such a beautiful thing about nursing is nurses love to help each other. They love to help everyone. So I have found just wonderful mentors along the way, but it does take, you getting out of your comfort zone and asking for that help and being specific and doing your homework. But people are really willing to help. And I love what you said about getting involved in your current roles because there is so much you can learn about, process improvement and things like that just by working in your hospital and keep track of those outcomes too because that's huge when you're talking in an interview and things like that.
And I will also plug that the
Yeah.
national and global nursing informatics community is so welcoming.
Yeah.
We do so much volunteer work, so much thought leadership work, and are willing to just reach out to if someone reaches out to you, a nurse on LinkedIn, they'll answer back, they'll connect you with someone else. So it's like you have micro mentors
Yes.
immediately. And there's so many places to get involved. And if nurses are interested, they'll definitely get an invitation to that.
Yeah, that's so wonderful. Thank you for sharing that.
Hmm.
All right. And we talked about kind of how broad nursing informatics, just that term is. So I think it's really important to talk about going to a job search engine and typing in nursing informatics might not give you all the results you're looking for because there's just so many different types of roles. Do you have any tips on, searching for roles or job titles if they're starting to explore what's out there in the field of informatics?
I think there's a few keywords you can use. Informaticists sometimes are called specialists and analysts. They might even be called builders. That's another way to technology builders. Using the term digital health or healthcare technologies is also helpful. I went into a role once that I just happened into that was the director of clinical transformation. And that's pretty vague.
Yeah.
You can kind of get from it what it meant, but it was an informatics role. I had applied for a different role and they saw my resume and said, "Oh, she's done what we need." So I would have never have clicked that. I would never have looked
Yeah.
at that if I didn't know. So there's a lot out there that you can find. It's time consuming, but
Yes, for sure.
putting in those other keywords I think is helpful along with innovation. Always say
Oh, yeah.
innovation. That's one that nurses should always check out if they're interested in informatics. You'll find a lot of technology buried in those job descriptions.
Yeah, and also if you do get involved with mentors or let, the people you're connected with know what you're looking for, sometimes those jobs can find you also like what you talked about.
Yeah.
All right. So what we kind of always end with is if there's a bedside nurse currently looking to move into nursing informatics, what would be your main advice for trying to land that first role?
I would say be aware that these roles are available. And as I kind of stated before, if you see a project, if you know initiatives coming, if you know there's a digital health solution or tool coming out, learn more about it and become, if you can, a super user on that project. That not quite formal informaticist who is a technology master, who has that massive interest in just wanting to learn it and already being good at other technologies. If you're recognized for that, that's more likely that you can become a super user. They're always looking for them when implementing something new. Again, we miss the voice maybe at the beginning, but once they know they need to put something on the floor or on the unit or the ward, they'll be looking for those people who are the experts in technology and have that great interest.
Yeah, that's great advice. Well, Wendy, thank you so much for sharing your time, your insight, and you just have so much expertise in this field. I think this is exactly what a lot of nurses need to hear as they're kind of looking for more possibilities in their career. And to our listeners, if this conversation sparked your interest in informatics, be sure to subscribe to the Non-Traditional Nurse newsletter for more interviews, resources, and real-world experiences from nurses leading these non-traditional roles. So thanks again, Wendy.
Thank you, Ellie, for the opportunity.
Thanks for tuning in. Have a good one.